faith isn't always easy. That's why we're here 24/7. Gospel 1360.
And good afternoon, ladies and gentlemen. Thank God for all of you to rolling with us this afternoon. It's another day that the Lord has made, and we're grateful to be able to stop down and talk to some very interesting guests. And today we're talking to Andrea Hoxie. She has Hoxie Insurance Solutions. And Andrea, how you doing?
I'm good. How are you today?
Doing fantastic. Just to give us some more knowledge about Medicare and Medicaid and what's the differences and what they can expect once they qualify for Medicare. And we're going to give you some more information about what she does and how she can help you right here on Gospel 1360. What is Medicare, Andrea?
Medicare is a health insurance program designed by the federal government for people ages 65 and older, or for people under 65 who have been disabled for a period of time or who have been diagnosed with end-stage renal disease or Lou Gehrig's disease.
What are the different parts of Medicare?
There are three distinctly different parts of Medicare. Part A covers hospitalization, skilled nursing facilities, and home health. Part B covers doctors and labs and diagnostic tests, durable medical equipment, and things of that nature. And Part D, as in dog, covers prescription drug plans. You will hear a lot about Part C, is generally a combination of the other three parts.
So now, when people qualify after the age of 65, what are the choices that are available?
You have two different choices, and within those two choices, you have a variety of other choices. The two distinctly different choices are that you stay with original Medicare with a standalone prescription drug plan. The other choice is to get a Medicare Advantage plan, which is also called Medicare Part C, and is a combination of A, B, and generally D.
If you just tuned in, we're talking to Andrea Hoxie. She's with Hoxie Insurance Solutions. So make sure you get a pen and piece of paper. We're going to give you a telephone number in just a few minutes. How does Medicare enrollment work?
Basically, 3 months before your 65th birthday, you're going to get a Medicare card in the mail. But if you've been disabled for 24 months and have been receiving disability income from Social Security, after you've been disabled for 2 years, you'll get a card in the mail. And if you were diagnosed with Lou Gehrig's disease or ALS, your Medicare card will come effective with your first disability payment.
So why is Part B optional?
Part B is optional. If you recall, I said it covers doctors and labs and things of that nature. It is optional because you have to pay for it. The monthly premium generally is $104.90 a month. And some people, if they have insurance through work, they don't really need to get it right away. And some people just don't want to pay for it, but that's not a good idea.
So do you recommend that they do?
If they don't have existing health insurance through their employer or some other means of accessing health care with insurance, it's better to go ahead and get Part B, because if you wait to get it, there's a huge penalty.
Excellent. Can you enroll in Medicare anytime?
Well, for most people, no. You have the initial enrollment period, which starts around your birthday month. There's a general enrollment period if you missed enrolling in A and or B, and that general enrollment period is January 1st to March 31st. But if you use the general enrollment period, your coverage does not become effective until July the 1st.
Now, how long have you been doing this? From our previous conversation, I think you said you've been doing it since like 1996. And why did you want to get involved in this?
Well, I got an insurance license. Actually, I became ill in 96, and I wasn't working, and I was kind of bored, and I just got an insurance license, I think effective around the 1st of 99. Which I didn't do anything with until someone came along and moved my mother out of her Medicare plan around 10 years ago, around 2005. And it took me a couple of months to get her back where she belonged, and it got me interested in Medicare plans and dealing with other senior health care issues.
Well, there's a lot of senior citizens that are listening to us here on Gospel 1360. How could you assist the Gospel 1360 listeners that are 70 years old, 75 years old, 69, 62. How would you assist these listeners that we have?
Well, everybody's situation is different, and I start off with a basic assessment, and that includes knowing what's important to a person in terms of their health care needs. If they have particular doctors that they want to see, then, and if they have drugs that they take on a regular basis, my first effort would be to find what plans fit the bill as far as accommodating those doctors and those prescription drugs. And then the other things to look for would be whether they need additional benefits like transportation and dental or other things that are not provided by Medicare but are may be provided by private companies that administer Medicare plans. And then also to determine what will fit the person's budget. Some people who have a substantial income don't have to worry about a Medicare Advantage plan if they are willing to pay for a supplement. But I meet people with challenging incomes and who either qualify for Medicaid or a low-income subsidy. So I will get around to asking personal questions about income, because if they don't already have those designations, whether it's QMB, which is Medicaid, Q1, which is a low-income subsidy, I want to help them get that so that that'll save them money by perhaps not having to pay the Part B premium or paying lower costs for their prescription drugs.
Not to mention the qualifications if they have a certain disease like diabetes or some kind of heart disease.
Actually, there are some Medicare Advantage plans designed specifically for people with chronic conditions. Those plans vary from state to state, but some of the common chronic conditions that are covered in Texas are congestive heart failure and diabetes. And generally, people who have one disease, they are susceptible to having other conditions, and so it's important to find a plan that will fit those needs.
So if a person has questions about the Affordable Health Care Act that's in place right now with President Obama, can they call you for questions?
Of course, they can call me for questions. I help people determine what their tax premium credit is. Generally, a family of four with an income as much as, say, $90,000 or $94,000 will actually qualify for paying health insurance premiums. And of course, the lower the income, the more premium credit they get to pay for health insurance premiums. I actually have a client who pays $10 a month for health insurance.
Wow, that is amazing. Ladies and gentlemen, we're talking to Andrea Hoxie. She has Hoxie Insurance Solutions. She's here with us today to give us some brief information. If you want some specific information about your circumstance, she certainly can be reached. Give us your telephone number for people that are trying to reach out to you.
My phone number is 713-626-4690. 713-626-4690.
And when you call that number, you can reach her directly, and if not, you can leave a message and she'll definitely get back with you. Got a few more questions for you, Andrea. What does Medicare cost?
Well, if you've worked and taxes have been deducted from your pay, then you've already paid for Part A generally, so you don't have to pay for Part A. Part B generally costs $104.90 a month, and that's typically deducted from a Social Security check or a retirement check. Some people have to pay more for Part B because if their income is greater than $85,000 a year for an individual, they actually pay more for Part B, and they pay an additional fee for prescription drugs. But then some people don't have to pay for Part B, and it's, again, income driven. So if they're into those lower income brackets, they get help with paying for Part B.
And this is something the government offers for people that have paid into the system more than 10 years.
Exactly.
Now, what happens if you're late enrolling?
Well, there are two different late enrollment penalties. For Part B, the penalty is 10% per year for every year that you should have been enrolled in Part B and you did not enroll in Part B. The only exception that I know of is if you have creditable coverage from like an employer or other independent health insurance, and you have to have some proof that you had this coverage, and you don't have to pay that penalty. There is no cap on that penalty. So if you went without Part B for 5 years, then you're going to pay a 50% penalty. The other penalty is for Part D, the prescription drug plan. A lot of people will say, well, I don't take prescription drugs, so I don't need to do that. And my question to them is that, do you have a car? And don't you insure your car, and you don't wait until you have an accident to insure your car? So, that ruffles the feathers, but it's the idea of the purpose of insurance. So you're sharing the risk. So the penalty for Part D is 1% per month for every month you should have had Part D and did not. And it's 1% of the national average. Right now it's somewhere around $30, $31 a month. So that's 30 cents per month for every month that you should have had Part D and you didn't enroll in Part D. For some people that I've met, that 30 cents per month over a 72-month period adds up.
It certainly does, and some of the listeners that are listening to us fall into that category. So, ladies and gentlemen, if you want more information about your specific information about you and your situation, this is the lady you need to talk to. Coming up on 20 years of experience in this area of insurance solutions, and she knows what's out here and what's available. So this is an interesting subject, and I notice your card has Obamacare on there. Since the Affordable Care Act has started, what are some of the common questions that people have when they call you?
Everybody wants to know if they can get help for paying that premium. And it is income driven. So again, we have to ask some very personal questions. How many people are in your household? Are you going to file an income tax return? You don't have to file an income tax return, but you have to provide the information based on your adjusted gross income. And it varies from household to household. Some people will pay more than others. So you can't say, well, my sister only pays X, which is, common because people will compare. But if your sister makes less money than you do and has a child and you don't have a child, then you're going to pay more money than your sister.
So, ladies and gentlemen, everybody's situation is different. And if you want more information, do you have a website?
I have a website. It's Hoxie, HOXIEIS.com. It has some general information on it. It has links to some companies. It lists the companies that I'm contracted with. And every now and then I publish a newsletter, so I try to put the newsletter on there as well.
How can some of our listeners support what you're doing?
Well, my goal is to provide substantial information to help people make a decision that's based on the facts, without the hype. I don't push a particular company. I only want to offer people what fits their situation. I have households where the wife is enrolled in one company's plan and then the husband is in a totally different company because that's what fits the individual. So my loyalty lies with the people I serve. And that's more important to me than winning a sales contest or a trip or whatever. I want people to be more proactive about getting the right information and to get the right care that they need for themselves, and to shy away from, what may sound good or what someone tells you that turns out not to be in your best interest.
So, ladies and gentlemen, if you really want to hone in on some of the questions that you have, you could ask this lady. It doesn't cost you any money to call. Give us that telephone number again.
The phone number is 713-626-4690. 713-626-4690.
That's 713-626-4690. You can call Andrea and she'll give you all of the information you need. If she doesn't know the information, she certainly will know how to find it. She has an incredible book here called Medicare Basics, a guide for families and friends and people with Medicare. If you meet with her, I'm sure she's going to give you this book as well so that you can have the information to pass on to your family and friends and to maybe some of your coworkers as well. Andrea, we thank you for joining us this afternoon.
Thank you for having me. It's been my pleasure to share this information with you and your listeners.
Telephone number is 713-626-4690. That's 713-626-4690. Hoxie Insurance Solutions joining us right here on Gospel 1360.